He was 72 when it occurred, retired, living solo, and attempting to cling to the last remnants of joy life could provide. That evening, he engaged in an activity he had performed countless times prior, just a moment of relief, a routine he believed was harmless. But something went awry. The following morning, he was discovered lifeless, in bed. No signs of violence or illness, merely a man whose body couldn't cope with what his mind deemed normal. I'm Dr. James, a men's health expert with over 3 decades of clinical experience addressing the needs of aging men. I'm sharing this because the most perilous health threats for older men aren't necessarily what you might assume. It's not solely strokes or heart issues. Sometimes it's what unfolds in the privacy of your bedroom, subjects rarely discussed. The irony is that something that once empowered you, instilled confidence, and provided relief might now be quietly harming your circulation, hormone balance, and even your lifespan. However, there is hope. By learning to adapt your habits after 60, you can regain your strength without jeopardy. In a moment, I will reveal the 5 masturbation mistakes that quietly undermine older men and the one lethal pattern that could be robbing you of years without your awareness. Before we delve into these 5 crucial errors, there's something vital you must grasp. These are not merely casual oversights or innocuous habits. They come with a price. For men over 60, this price can be far graver than you realize. The reality is that your body has transformed. The way you masturbate may no longer align with what your aging heart, nerves, and hormones can safely manage. What once brought relief can now gradually evolve into strain, inflammation, and long-term deterioration. So, before we discuss the specific mistakes, allow me to illustrate what's truly at stake. Because unless you comprehend the cost, you won't recognize the danger. You might still consider it harmless, a private act, a means to relax, to remain in touch with your body. But after 60, simple habits can become risky. Your blood vessels are stiffer, your prostate more sensitive, your heart less forgiving. Yet most men continue to engage in what they did in their 30s, oblivious to the fact that every poorly timed session, every forced climax, and every careless repetition is quietly draining the vitality from them. Initially, it's subtle fatigue, a waning erection, that persistent discomfort in the lower body. But then the damage escalates. Pelvic congestion, nerve inflammation, rising blood pressure, chronic prostate swelling. You find yourself waking up at night to urinate. Your desire diminishes. Your sleep becomes lighter. Your confidence wanes. And no one ever informed you that it could all trace back to this. I've witnessed men in their 70s sitting across from me, ashamed and defeated because they were unaware. No one cautioned them that the habits they relied on were gradually silencing their masculinity from within, and this isn't merely physical harm, it impacts your pride, your mood, your ability to feel alive. These mistakes won't stop your heart tomorrow, but they will make you feel as though you've already lost something essential. And it all begins with the first mistake. One most men commit every morning without a second thought. Mistake 1. Masturbating immediately after waking up or when blood pressure is elevated. I've encountered this error countless times in my practice. It's quiet, seemingly innocent, yet it's one of the most perilous habits a man over 60 can adopt. Masturbating first thing in the morning might have felt invigorating in your youth, but at this age, your body isn't waking up with the same vigor. Your blood pressure is naturally elevated in the early hours, and your cardiovascular system is more susceptible than it once was. When you stimulate yourself during this fragile phase, before your heart has fully stabilized and your circulation has equilibrated, you're placing immense strain on a system that no longer recovers as swiftly. I had a 68-year-old patient who would rise every day and commence his morning with what he referred to as his routine release. He believed it kept him sharp and calm, but over time he began to experience dizziness, chest tightness, and fatigue that persisted throughout the day. Initially, he thought it was simply aging, but the reality hit him hard when we traced the symptoms back to his morning habit. His body simply could not manage the surge any longer. It wasn't about the act, it was about the timing. I understand that for many older men, mornings are when privacy and arousal naturally coincide. But that doesn't imply it's safe. Not. When your heart, blood pressure, and nervous system are all attempting to stabilize after sleep, the risk isn't in the release itself. It's in forcing your body into arousal before it's ready to bear the burden. There exists a better method, a safer time, but we'll discuss that shortly. First, let's address another error that may astonish you even more. This one doesn't occur in the morning, but rather deep into the act itself. And it's quietly, inflicting long-term harm without your awareness. If you've made it this far and these revelations resonate with you, type the number 1 in the comments to let me know you're still present and prepared to take charge of your health. Now, let's continue with the next critical insight. Mistake 2, attempting to hold back or edge for too long. This error is more prevalent than most men will admit. They don't discuss it, yet they engage in it. They try to prolong the experience, to hold back, to hover near the edge of climax, believing that more time translates to more pleasure, more control, perhaps even more youth. I understand that instinct. I truly do. When life feels as if it's speeding up or slipping away, slowing down a moment of intimacy seems like regaining something. But after 60, your body no longer adheres to the same rules. What you perceive as control may actually be wreaking havoc in your lower body, pressurizing your pelvic nerves, congesting your prostate, and generating tension where there should be release. I recall one 71-year-old man who came to me with persistent pelvic pain and odd pressure sensations following each session. He had practiced edging for years, believing he was maintaining discipline, yet inside, his tissues were inflamed, his prostate swollen, and his nerves firing in confusion. What he thought was strength was, in reality, resistance. His body was pleading for rest, not more strain. When you edge for too long, you disrupt your body's natural rhythm. You keep the nervous system in a heightened state of alert. You push blood into areas that cannot drain properly. Over time, this results in fatigue, erectile instability, and even chronic pelvic pain syndrome. Your body begins to perceive pleasure as a threat rather than a gift. It forgets how to relax. It forgets how to let go. There's nothing wrong with wanting to savor the moment, but there exists a fine line between enjoyment and overstressing, and most men cross it without recognizing the cost. If this error surprised you, just wait until you hear the next one, because it's not about what you do, but rather when you do it, and that timing could be hindering your health without your realization. Mistake 3, masturbating when tired, ill, or after heavy meals. It may appear harmless. You're lying down, feeling a bit off, perhaps after a long day or a heavy dinner, and you think a little release might help you sleep or alleviate stress. But at this stage of life, that seemingly simple decision can carry a cost your younger self never had to consider. Your body is not only older, it's more delicate, more reactive, and less forgiving when already under strain. Masturbating while your system is depleted, whether from fatigue, illness, or digestion, adds another burden to a body already trying to recover. And the reality is, it can quietly wear you down over time. I recall one gentleman aged 74 who informed me he often used masturbation to aid in falling asleep when feeling weak or bloated. However, over the years, he began to feel increasingly drained afterward, not better. His heart would race, and he would wake up multiple times during the night. He thought something was wrong with his age or diet, but the real issue was timing. He was forcing his body to engage in a demanding task when it was already requesting rest. When you're fatigued, your nervous system is already in a state of imbalance. When you're unwell, your immune system is working to protect you, and after a heavy meal, your circulation is directed towards digestion, not stimulation. Thus, when you masturbate in these states, you're diverting energy from recovery and redirecting it to a process your body isn't prepared for. It may not harm you immediately, but the cumulative stress on your heart, hormones, and pelvic floor accumulates, gradually undermining your vitality from within. And if you believe that's a subtle danger, just wait until you hear about the next mistake. Because this one isn't about how you feel. It's about how often you push your body beyond its limits without even realizing it. If you're still tuned in and these insights are resonating, drop a number 1 in the comments to let me know you're still engaged, because what follows may be the most crucial mistake of all. Mistake 4. Masturbating too frequently, daily, or multiple times a day. This topic is challenging to address since it touches on something profoundly personal. For many older men, masturbation transforms from a mere habit into a coping mechanism, a way to navigate loneliness, stress, boredom, or simply to reconnect with something familiar. In a world where your body is changing, your relationships may feel distant, and your sense of control is fading, it's easy to fall into the pattern of indulging daily or even multiple times a day. But I must be candid. After 60, your body doesn't rebound like it used to. What feels comforting in the moment could be draining your energy, weakening your hormones, and pulling you deeper into fatigue than you realize. I once had a 67-year-old patient who arrived exhausted, mentally foggy, grappling with low mood, low libido, and muscle loss. He felt embarrassed to share, but eventually admitted he masturbated 2 or 3 times daily. He claimed it helped him cope, but his body was exhibiting signs of depletion, low testosterone, adrenal fatigue, and early signs of erectile dysfunction. The very act that once provided him relief had devolved into a cycle of exhaustion. His system was perpetually firing dopamine, adrenaline, and stress hormones without the opportunity to reset. His nervous system was stuck in overdrive, and he wasn't even aware of it. Overstimulation doesn't always feel intense. Sometimes it feels normal, until one day you awaken and realize everything feels a bit more challenging, a tad more distant, a little less vibrant. Masturbating excessively may appear as a private indulgence, but over time, it resembles a slow leak in your vitality, one that's difficult to detect until the damage is irreversible. And if you believe frequency is the sole concern, think again. The final mistake may be the most overlooked of all, and it relates entirely to how your body is positioned during those private moments. Mistake 5. Adopting incorrect posture, lying on your stomach, sitting hunched, or applying excessive pressure. This is one of those errors that seems trivial until it escalates. Most men never reconsider the position they assume during those private moments. It's something we've done similarly for years, sometimes decades. But after 60, how you position your body while masturbating matters more than ever. Incorrect posture can silently compress nerves, restrict blood flow, and generate tension in areas already more vulnerable with age. I've witnessed men experiencing numbness, tingling, loss of sensitivity, and even pelvic pain solely because they were lying face down, sitting too long, or applying excessive pressure without realizing the repercussions. I remember one gentleman, in his early 70s, who approached me with complaints of a dull ache in his lower back and an unusual tingling sensation down his leg. He had consulted chiropractors, taken pain relievers, and attempted stretching. Nothing yielded results. Eventually, during a quiet conversation, he confessed he often masturbated lying on his stomach, pressing hard into the mattress for stimulation. It had never posed an issue before, but now his body couldn't manage the compression. His pelvic floor was strained, his circulation restricted, and his nerves were protesting after years of neglect. The solution wasn't medication. It was awareness, gentle adjustments, less pressure, and more care. When you sit hunched or apply constant downward force, you're not merely risking discomfort. You're training your body to respond to tension rather than pleasure. Over time, that pattern can dull your sensitivity, weaken your arousal response, and make genuine intimacy feel awkward or numb. It's not about shame, it's about self-respect, learning to treat your body with the patience and gentleness it now requires. If you've recognized yourself in any of these mistakes, don't fret, as it's time to pivot. You've learned what to avoid, but what does safe, healthy, age-appropriate self-pleasure look like after 60? Allow me to guide you on what to do instead. After hearing all these warnings, you might feel overwhelmed, perhaps even a touch ashamed. Please refrain from feeling that way. This isn't about guilt, it's about awareness. You're not broken. You're aging. And that means your body warrants a different kind of attention, one rooted in care rather than habit. The encouraging news is you can still find enjoyment. Pleasure doesn't have to vanish with age, it merely needs to evolve. You just have to approach it with greater respect, more patience, and a better understanding of your body's needs. Begin by slowing down. Choose a moment when your body is rested, not immediately after waking, not when you're exhausted or full, but when you are calm, relaxed, and emotionally at ease. Allow yourself to breathe deeply. Avoid rushing, forcing, or gripping tightly. Concentrate on sensation rather than performance. Let pleasure build naturally and release when your body is prepared, not when your mind demands it. A couple of times a week is ample for most men over 60. If you're recuperating, fatigued, or healing, once a week or even less might be precisely what your body requires. Be mindful of posture. Avoid lying on your stomach or hunching over. Instead, find a position that supports your spine and alleviates pressure on your pelvic nerves. And finally, if you've depended on porn for decades, now might be the time to let it go. It desensitizes you, rewires your brain, and replaces genuine connection with artificial distractions. Your mind and body deserve better. It's not about sacrificing something. It's about learning to retain it without inflicting harm in the process. Men who grasp this don't merely safeguard their health, they preserve their dignity, confidence, and manhood. But if you're still pondering what transpires if you disregard this advice, stay with me, as I'll reveal precisely what's at stake in the conclusion. Final warning, the choice is now yours. By this point, you've seen the truth most men never hear until it's too late. The small, seemingly innocuous habits you've carried for decades can gradually erode your strength, confidence, and ability to feel alive in your own body. And it's not due to having done something wrong, it's because no one ever informed you how things evolve after 60. How your heart, nerves, hormones, and energy become more fragile, more reactive, and more deserving of care. You've learned that timing is crucial, that masturbating right after waking when your blood pressure is elevated can endanger your heart, that attempting to hold back for too long may feel empowering, but generates pressure that your prostate can no longer accommodate. That engaging in it when you're fatigued or bloated consumes energy your body desperately needs for healing. That doing it too frequently subtly drains your vitality. And that posture, the manner in which you treat your body during those private moments, can lead to lasting tension or numbness if neglected. Most importantly, you've discovered that it doesn't have to be this way. You need not forfeit pleasure. You simply must choose to approach it differently, with intention, respect, and the wisdom you've gained through age. That's not weakness, that's strength. I've assisted hundreds of men in transforming their health simply by becoming more mindful of what once felt automatic. You can be one of them. You can still feel good, still feel like a man, and still live with clarity and control if you're willing to release the habits that no longer benefit you. The next step is yours. But remember this, the most perilous mistake isn't any of the 5 I've outlined. It's ignoring them and pretending they don't apply to you. Don't let that be the one you regret. If this message resonated with you, don't merely scroll past. Take a moment to comment, "I'm making the change," below. Share this video with another man who needs to hear it. And if you haven't done so already, hit that subscribe button to ensure you never miss another truth that could safeguard your health, confidence, and manhood. Your future self will express gratitude starting right now.